Hello, everyone, and welcome to Care Talk. I am Felicia Wilson. Listen, we're just going to take a few moments and talk about family caregiving and children. When we're having these conversations about family caregiving, typically children are left out of the conversation, but they are very much part of the whole family caregiving dynamic. It can be extremely confusing to a child seeing how their life has shifted in order to take care of an aging loved one. I want to talk to you about how you can have conversations with your child so that they don't get lost in the shuffle and they feel heard and seen and given an opportunity to contribute to caring for their loved one. When my daughter realized something was going on with her grandmother, she said something that I don't think I will ever forget. Grandma is losing her memories. And now you have to understand, at this point, she was very young. But for her to make the connection when we didn't directly have a conversation with her was pretty cool. So, of course, then conversations needed to be had so that she could understand exactly what was going on. So grandma wasn't trying to be funny when she asked something again, or if she did something. It was truly because her brain was changing. Depending on what the diagnosis is, you need to break it down in a way that your child can understand based on their age. Then you need to talk about how life is going to change. Maybe that your loved one doesn't live in the home with you, so that means you're going to go to their home more often to make sure they're okay. Make it fun. Take things to the home so that when you get there, your child has something to do. Another option is to involve them in the care. Now, we know that there are certain things that a young child can't do, but what are some of the things that he or she could do? Can they fold towels? Can they sit and read a book with grandma or grandpa? That would be great for both generations. That would actually offer some very nice bonding time. For as your child gets older, or if you have older children, think about how they can contribute to the care. I think this does something for your aging loved one and lets them feel the connection from their grandchildren, if that's what the relationship is. But it also teaches your child to serve and to give and not have anything coming back to them in return other than possibly having a good time. Doing this and thinking through how family caregiving is going to impact your household and impact your minor children, you have to give consideration to how they can then become part of the process and not just, tagging along, so to speak. Involve them. Ask, for feedback. Ask them how they can help serve your aging loved one, their aging loved one. Making cards or singing a song, any type thing would be a wonderful addition to the caregiving process. I think if you find time to have this conversation with your children, you will be really impressed that they want to help. Maybe not the teens so much, but also it gives them something to look forward to. Before I close, I do want to give a side note that if they have not had a very close relationship with their aging loved one, it may take a little more time for them to fully embrace helping. And that's because they may not feel a connection, therefore they may not have a quick desire to help. If that's the case, don't push them. Allow it to happen and maybe even show them how helping in this way helps the family unit as a whole. But please do be sensitive based on how that relationship has been before your aging loved one got sick. Okay, I hope this information has been helpful. If so, please don't forget to like, share, and comment. Until next time, take care.